Hi, ladies. So week 2 is already upon us. Our topic this week is regulation of healthcare facilities. Our objectives this week are to examine regulations and regulatory agencies affecting the operations of healthcare facilities and the delivery of care to consumers. We're going to discuss why healthcare is heavily regulated and why it should be. We're going to identify 3 federal agencies within the Department of Health and Human Services and their roles in regulating healthcare. We're going to explore standards of care and the impact they have on consumer healthcare. And we're going to take a look at 2 agencies. Some examples are Joint Commission, CARF, who evaluate how healthcare facilities comply with establishing standards of care. Our discussion forum is to look at why is healthcare so heavily regulated. I want you to research 3 federal agencies within the Department of Health and Human Services, identify them, and share their role in regulating healthcare facilities. Give me your opinion. Which agency do you think imparts the most regulations on healthcare facilities, and support your answer with facts. This is just in some of the agencies that you could discuss. Agency for Healthcare Research and Quality, Agency for Toxic Substances and Disease Registry, Centers for Disease Control and Prevention, the Food and Drug Administration, Health Resources and Service Administration, Centers for Medicare and Medicaid Services, Indian Health Service, National Institutes of Health, Substance Abuse and Mental Health Services Administration, the Offices of the Assistant Secretary for Preparedness and Response. You can take any one of those or any other ones that you see or research and talk about. Our assignment is to do a PowerPoint of at least 6 slides with a voice overlay. All of the instructions are on Canvas to do that. Please have at least 3 citations. And the topic is to develop this presentation comparing 2 agencies who evaluate a healthcare facility of your choice, who wishes to comply with established standards of care to meet special or voluntary accreditation recognition. Some examples are Joint Commission, CARF, CMS, and Health and Human Services regulations, such as the Department of Public Health. Again, if you have any questions about that, please don't hesitate to email me either in Canvas or through our BayPath email. If you really want to discuss anything over the telephone, email me and we can set up a time to do that. Thanks, ladies. See you online.